When you think about healthcare data, I mean, it's just overwhelming, isn't it? Electronic records, insurance stuff, wearables feeding in data constantly.
It really is a huge mountain of information.
Exactly. And it's not just sitting there. It holds incredible potential. And tools like Amazon Redshift are key to unlocking that.
That's right.
So if you've got data skills, especially with Redshift, well, you're potentially looking at helping build things that could genuinely save lives or just make healthcare run, so much better.
Absolutely. We're seeing this massive wave, this tidal wave of healthcare data. But collecting it is just step one. The real value comes from, well, from understanding it.
Right. Making sense of it all.
Yeah. And that's where analytics comes in, powered by tools like Redshift. So for this deep dive, we really want to focus on why Redshift is such a good fit here and who the key people are making it all happen.
Okay, so let's start there. Why Redshift specifically? What makes it stand out for handling all this complex healthcare information?
Well, a few big things. First, scale. Redshift is built to handle just enormous data sets. We're talking petabytes.
Petabytes, wow.
Yeah, which is, over a quadrillion bytes. And that includes structured data like billing records, but also semi-structured stuff like diagnostic codes linked to medical images.
Okay.
Its whole architecture is designed to scale up as that data volume grows, which it definitely is in healthcare.
And I imagine speed is crucial too. You can't wait days for an analysis in a clinical setting.
Exactly. Speed is another huge factor.
Yeah.
Redshift can run really complex analytical queries very, very quickly.
Mhm.
And that speed powers the kind of, real-time or near real-time dashboards that doctors, nurses, administrators need to make quick, informed decisions.
That makes sense. Fast analysis is definitely a game changer. But what about security? Healthcare data is incredibly sensitive.
Oh, absolutely paramount. You can't overstate it.
Okay.
Security in healthcare isn't just a feature. It's fundamental.
No.
Redshift has multiple layers built in. Things like really robust access controls, so you manage exactly who sees what. Encryption, both for data sitting still and data moving around.
Okay.
And importantly, detailed audit logs, so you have a record of who accessed what when. These are all essential for meeting regulations like INAPA and, fundamentally, for protecting patient privacy.
Got it. So secure, scalable, fast. That sets the stage. Now, who are the professionals actually using this? Who's digging into the data?
Right, so we're seeing several key roles really leveraging Redshift. First off, you have clinical data analysts.
Okay, what do they do?
Think of them as patient data detectives. They use tools like SQL, that's the standard language for databases, and various BI, business intelligence platforms.
Mm-hmm.
They query Redshift to pull out insights about groups of patients. They might build dashboards to track, say, population health trends or how effective a certain treatment is, or patient outcomes over time.
So they're looking at the bigger picture, not just one patient at a time, finding those patterns.
Exactly. They translate that raw data into insights that can actually improve how care is delivered.
Interesting. Who else?
Then you have healthcare data scientists. They often take things a step further. They're building predictive models.
Predictive models, like what?
Things like predicting the likelihood of a patient being readmitted to the hospital shortly after discharge, or maybe forecasting the progression of a chronic disease based on certain factors.
Oh, okay.
They use the large data sets stored in Redshift, often integrating with machine learning tools like Amazon SageMaker, or even Redshift ML, which is built right in.
Yeah.
The goal is really proactive intervention and more personalized care.
That's fascinating. Being able to anticipate problems.
Yeah.
Now, what about getting all that data into Redshift in the first place? That sounds like a job in itself.
It absolutely is. And that's where healthcare data engineers come in. They're the architects, the builders of the data infrastructure. They design, build, and maintain the data pipelines. So pulling data from all those different sources, electronic medical records, lab systems, pharmacy systems, scheduling tools, and getting it reliably into Redshift.
Right. Connecting all the dots.
Exactly. And crucially, they ensure data quality, data security along the way, and make sure the whole Redshift environment is tuned for optimal performance. They really lay the groundwork.
Makes sense. The foundation.
Right.
Are there other roles focused more on the business side of healthcare using this?
Yes, definitely. You also have BI developers and operations analysts. Their focus is often more on organizational efficiency and cost reduction.
How so?
They use Redshift to visualize key performance indicators, KPIs, things like hospital bed utilization rates, staffing levels in different departments, maybe tracking the efficiency of the medical supply chain.
Okay, so operational metrics.
Right. By making these KPIs visible and easy to understand, often through dashboards, they help leadership spot inefficiencies, optimize how resources are used, and ultimately try to lower operational costs while maintaining quality care.
It sounds like from a leadership perspective, finding people with these Redshift skills plus healthcare knowledge must be tricky but essential.
It is. Leaders are recognizing that just having the tech isn't enough. You absolutely need professionals who understand both Redshift and the healthcare domain.
What does that mean, healthcare domain?
It means understanding things like specific data formats used in healthcare. You hear terms like HL7 or FHIR, but also knowing the regulatory environment, especially IPPEA and patient privacy rules. And crucially, understanding how clinical workflows actually happen on the ground.
So it's a specialized blend of skills.
It really is. So leaders are either making very strategic hires or sometimes they partner with specialized talent networks to find people who have that specific combination.
Okay, so let's flip that. For data professionals listening, maybe folks already skilled in Redshift but working in, say, finance or retail, what's the message for them about healthcare?
The message is there's a huge opportunity here right now. Healthcare desperately needs strong data skills, especially Redshift expertise.
The growth area, then.
Absolutely. And the work can be incredibly meaningful. You're contributing to something vital.
What can they do to become more attractive for these roles?
Well, definitely upskilling a bit in those healthcare specifics we mentioned. Learning about data formats like HL7 and FHIR makes a difference.
Right.
Maybe explore some publicly available healthcare data sets. There are things like the MIMI3 database or data from CMS, the Centers for Medicare and Medicaid Services. Getting hands-on helps.
Practical experience.
Exactly. And just generally trying to understand clinical workflows and the absolute necessity of privacy controls in this space. It shows you get the context.
So Redshift skills plus that healthcare context equals a really valuable combination.
Precisely. It's a chance for a really rewarding career where your tech skills have a direct positive impact on people's health and well-being.
It's really clear that Redshift professionals are making a significant mark on healthcare, driving improvements across the board.
No question about it, from patient care right through to making the organizations run better.
So whether you're listening as a healthcare leader trying to build out your analytics team, or you're a data pro thinking about where your skills can make a real difference, this field is just full of potential right now.
Absolutely. And if you want to dig deeper into these specific roles, the kind of work they do, how Redshift fits in, we definitely recommend checking out the full blog post for more detail.
Good call.
And of course, subscribe or follow us for more deep dives like this into data, talent, and how it's all transforming industries.
It really is amazing to see data, tools like Redshift, and skilled people coming together to shape a better future for healthcare. It just highlights how important that continuous learning is, doesn't it?
It really does. The landscape is always evolving and the potential for impact keeps growing.